Hippocrates, the father of medicine, said, "Look to the spine as the cause of all disease." Thomas Edison said, "The doctor of the future will give no medicine, but will interest his patient in the human frame and diet and exercise." And today, moving forward few hundred years, we have this profession called chiropractic.
Here, put your fingers right there. Now push. Nice. See, you could be a chiropractor.
Hey interns, Dr. Chris, orthopedic surgeon. Welcome to my latest video. If you're a fan of this channel, you'll know I have critiqued chiropractic practices extensively. In a recent video, I examined whether the staple technique of spinal adjustment is a scam, reviewing the scientific evidence regarding what really happens during treatment. I suggest you watch that video first if you haven't seen it. My main concern is that the chiropractic community often promotes back cracking as a cure-all for various health issues, a perception rooted in the foundational beliefs of chiropractic care, but minimally supported by clinical research.
He just seems to be having some allergies that won't go away. He's been sniffling a lot.
One chiropractor who has gained significant attention online is Dr. Rahim, who apparently has a 95% success rate. I wanted to know what all the hype was about. I noticed that in a world of showy practitioners, he stands out by adopting a straight to the point yet holistic approach to care.
3, 4, 5 keeps the diaphragm alive.
He stays true to the core principles of chiropractic while utilizing the Gonstead method, which focuses on mastering the art of delivering precise adjustments.
You ever heard me say that?
Don't get me wrong. From a public perspective, he seems extremely charismatic, confident, and good at his job. But as a doctor who's trained to be skeptical, it's important to critically assess healthcare methodology.
Anytime a chiropractor puts somebody's health in danger, it makes the rest of our profession look bad.
In today's video, we'll discuss the founding principles of chiropractic care, particularly how the nervous system facilitates health. We'll also explore the Gonstead method and share some specific observations I have about Dr. Rahim's approach.
I came in there and it was great energy, like it just felt different.
The first thing I noticed is his fundamentalist approach to chiropractic care. This is based on the body being an interconnected biological system with a natural state of health. This I agree with. We have many organs and many processes going on all at once within it, but its proper functioning is primarily due to the nervous and endocrine systems.
What's the most important organ in your body? The nervous system. It controls and coordinates every function. It is protected by your spine.
It is through the nervous system that we communicate with the outside world, and at the same time, many mechanisms inside our body are controlled by it. It consists of neurons or nerve cells. Each neuron has a cell body and various extensions. The shorter extensions, called dendrites, act like antennae. They receive signals from, for example, other neurons and pass them on to the cell body. The signals are then passed on via a long extension, the axon, which can be up to 1 meter long. It's categorized into the central nervous system, our brain and the spine, and the peripheral nervous system. Basically, everything else.
You know what the cobra is?
The cobra! The central nervous system, or CNS, receives, processes, and responds to sensory information. The brain, a delicate organ responsible for movement, sensation, emotions, and memory, is protected by the skull, meninges, and cerebrospinal fluid. The spinal cord, housed within the vertebral column, transmits signals between the brain and the body, sending motor commands out and relaying sensory information back, and is similarly protected. As we move outwards, we have the peripheral nervous system, or PNS, which is divided into two main parts. The somatic nervous system controls voluntary movements such as those of the face, arms, legs, and the torso. In contrast, the autonomic nervous system regulates involuntary functions like breathing, heartbeat, and metabolism.
Deep breathing.
It receives signals from the brain to manage bodily processes and sends feedback such as bladder fullness or heart rate. Here's a quick example of how the nervous system works. When you see a stove and recognize it as something you can touch, your brain decides to reach out for it. if you touch it and feel the heat, the sensory nerves in your skin detect the heat and send a signal through the PNS to your spinal cord and then the brain. The CNS quickly processes that sensation and sends a motor command back through the PNS to your muscles, prompting you to pull your hand away. This rapid response helps protect your body from injury. You could understand then how if something physically impinges on these structures, it becomes more difficult and in some cases impossible to carry out the transmission of this information.
When there is interference between the brain and the rest of the body cannot express itself. And that interference causes dis-ease or disease.
So far, Dr. Rahim and I are on the same page. Of course, we want the body to communicate effectively within itself, and it is based on this premise that chiropractic practice was developed. Since the spinal cord serves as the primary link between brain activity and physical activity, and as Dr. Rahim explains, it is mechanical in nature, meaning it can break down over time or at least require maintenance. A focus on spinal health as the protector of the nervous system is essential for overall health.
Do you know why that's happening? Why this looks like that?
No clue.
This is all related to the spine.
Now, I want to point out that the spinal cord is a biologic entity without rigid structure or moving parts. So my viewpoint of the spinal cord differs here, as I do not see it as a mechanical structure that might break down in the same way as might the vertebral spine. While it can be injured or damaged, it generally does not have mechanical forces acting directly on it. Also, as mentioned above, the body communicates through both neurologic and endocrine systems or hormonal means. Proper functioning of both are required for overall health, so it is incorrect to suggest that spinal health is the sole determinant of overall health, as it is merely only a contributor.
The one cure is the removal of obstruction to healing, because we know the body is self-healing, self-regulating.
It is important to understand that the body is an integrated system and that nerve networks are interconnected. And it seems like Dr. Rahim knows that well, as he's often pointing out to patients how seemingly unrelated parts of the body are connected to each other and work collaboratively.
Quads are going to be L2, L3. T12 can go here. But we're looking at the mid-lumbars, if we're talking about specific nerve supply to the muscle.
So the idea is then, if nerves in one area, like the hand, are linked to the brain and other parts of the body, and there's interference or damage in one spot, it can lead to unexpected issues such as allergies, headaches, digestion issues somewhere else. For example, the vagus nerve, or cranial nerve number 10, the 10th of the 12 cranial nerves, plays a key role in the gut-brain axis, with most of its nerve endings located in the intestines. As explained by the Cleveland Clinic, it helps regulate digestion by controlling gastric functions and gland secretion. Beyond the gut, it influences memory, emotion, and cognition through its connection to brain areas like the cortex, amygdala, and hippocampus. It can detect signals from the gut metabolites via various receptors, and changes in this signaling can lead to functional alterations in the brain, which may contribute to mental disturbances such as substance dependence, mood disorders, and eating disorders. Again, this is why chiropractors emphasize that addressing the spine, and in turn the nervous system, is not just for joint mobility, but for a whole host of issues as well.
I'm not going to deal with that. I'm going to send you to somebody who knows how to deal with that and who's been trained in that.
However, to say that nerve damage or irritation can influence problems such as allergies, a condition that is governed by the immune system, is a far stretch.
The training that chiropractors and others of that ilk who have really are not trained in the area of clinical immunology, clinical allergy. They shouldn't be treating that kind of stuff.
There is no scientific evidence that I know of to verify this connection.
I had less allergy issues. There's a whole philosophy behind it that he has, and he's not just a chiropractor. He's completely different. He's like a doctor for everything because your nervous system controls everything.
And here's where chiropractors try to solidify their theory. Nerve compression. Nerve compression often affects nerves that travel through small openings called tunnels or canals in your joints. Tissue swelling or damage can put pressure on these nerves at these areas, leading to symptoms such as sharp or burning pain, numbness, and weakness in the affected limb. Individuals may also experience radiating pain, increased sensitivity to touch, and loss of coordination, especially in the hands and the feet.
My foot fell asleep. Yeah. Oh. It's out cold.
Most of us have felt the pins and needle sensation when a foot falls asleep, which typically resolves once we change position and relieve the pressure.
Good night, foot. Sleep tight.
However, persistent nerve compression or trauma can result in more permanent nerve damage or irritation, known as neuropathy. Depending on the affected nerves, this can lead to muscle weakness and atrophy. Nerve damage in the central nervous system can result in paralysis, as seen in individuals with paraplegia or quadriplegia due to a severed spinal cord. So at the very least, there are some issues that a back cracking just ain't gonna fix, bro.
He'd like to give the chiropractor he saw a piece of his mind.
It didn't work, and he lied to my family.
The theory is that blocks interfering with the signal, nerve impingements, are caused by subluxations, or misalignments of the spine. Chiropractors claim that by applying high velocity manual force to malpositioned spinal segments, they are able to essentially snap the back into place. And this is where my issue is.
He can't do this. It's dangerous.
There has been ongoing debate regarding the definition of subluxations and the efficacy of chiropractic practices on treating these supposed misalignments. For instance, Alessandro Marcone et al. Noted in a 2019 article that in 2010, the chiropractic vertebral subluxation complex is a historical concept, but it remains a theoretical model. It is not supported by any clinical research evidence that would allow claims to be made that it is the cause of disease. This is largely due to the significant differences within the chiropractic community on how subluxations should be defined, and that there is currently no gold standard for detecting them. Overall, chiros view subluxations within a holistic framework that highlights the connection between the musculoskeletal and nervous systems. Issues in one system can lead to problems in the other.
This was out also that predisposed all this other stuff.
For example, together they control movement and provide sensory feedback for coordination and balance.
Question is, the chicken or the egg, which one came first?
Chicken.
Additionally, issues in joints or muscles can affect pain perception, and muscle tension can disrupt automatic bodily functions controlled by the nervous system, such as heart rate and digestion. So misalignments or subluxations in the spine might possibly disrupt this delicate balance of these systems and potentially impact overall health. Maybe. But the reality is that it's very rare for the actual vertebrae, the bone segments connected by joints, to be significantly shifted out of place. Many people may get this impression from how chiropractors discuss it, but the body is an extremely finely tuned instrument, and even minor changes can make a significant difference.
And you have a side slip at T6, and that's why it hurts when you go on your right side.
A spinal slip, or spondylolisthesis, occurs when a vertebrae slips out of alignment and moves forwards or backwards with respect to the one below it. And though this can happen, and sometimes when we look at x-rays, bones can appear janky, what patients typically experience is only joint irritation rather than actual vertebral shifts.
So we're looking for that flexion extension at each individual segment. 7 is not moving. 6 is moving. 7 is not moving.
So what chiropractors are looking for is joint inflammation or restriction. And the goal in these cases is to restore mobility and encourage movement confidence. As a surgeon, I want to emphasize that surgery is the last resort in MSK treatment, with chiropractic care usually being one of the first steps. We don't want to resort to surgery for any minor issue, especially given the high risks involved.
Sprain means ligament, strain means muscle. Grade 1, 2, 3, mild, moderate, severe. Severe grade 3, surgical case, that's not her case. Okay, so what I'm doing is I'm putting the bones in better opposition so that the ligaments can heal better.
I support the use of non-invasive treatments, and responsible chiropractic care can be a valuable tool for rehabilitation, especially for those who are looking to avoid prescription medications, which might numb the pain and address the symptoms, but not its underlying cause.
But our progress has been amazing.
Tell me.
So it was 2 weeks ago.
We've had what, 5 visits?
This is our 5th visit, yeah.
However, the problem arises when chiropractors don't really solve the issue, instead fostering a dependency on their services for temporary relief, leading patients to return week after week without long-term improvement.
Over how long though? Hold on, I'm sorry, I didn't mean to cut you off. Since May, we're end of July.
Yeah.
So this isn't, I saw you 3 times a week.
Yeah.
So is Dr. Rahim using the Gonstead method actually more reliable?
People aren't coming here for just the adjustment. They're coming here to know where the problem is, what the problem is.
Dr. Rahim advocates for functional medicine, which focuses on treating the root causes of health issues. This approach emphasizes addressing lifestyle habits including nutrition, blood chemistry, and body patterns to correct imbalances before symptoms or diseases can develop. Focusing on prevention is absolutely crucial in medicine. Both the responsible medical professional and the responsible patient are not here to waste time, nor are they here to waste money. We want to genuinely solve the problem. And the Gonstead method, which Dr. Rahim practices, apparently has aimed to do just that. Yeah, we'll see. We'll see.
Part 2 is she has a lot of inflammation in her body. Number 3, she got to change her diet.
Okay.
There's no ands, ifs, or buts.
Yeah.
We got to get her walking again.
The founder of this method, Dr. Clarence Gonstead, drew on his mechanical engineering background to develop a thorough scientific method to diagnose and treat patients. Gonstead emphasized that certain spinal manipulations, such as neck adjustments, could be harmful and potentially lead to complications like stroke. So he created a more advanced diagnostic procedure to accurately identify spinal misalignments.
I'm going to go over your x-rays first.
Okay.
We didn't take ankle, foot x-rays. We do extremities, we do all that, but everything starts in the foundation.
Dr. Rahim appears to follow a methodical approach compared to some other practitioners I've observed. It's not just about feeling around pain and cracking wherever the patient points. There's a structured process involved. As a healthcare provider, I recognize the value of treating intuitively, understanding that each patient is unique.
Everyone's story is unique. Everyone's story is individual. There's no cookbook recipe to what's causing your issue. We can have 10 people with digestion. It can be a different nerve causing it.
As Dr. Rahim says, there's no textbook answer. The Gonstead method emphasizes a thorough evaluation, and while patient testimony is not the sole focus, it's important to hear their backstory and lifestyle, and Dr. Rahim takes the time to do so. Dr. Stuart McGill, a respected back specialist and biomechanist, highlights the necessity of understanding a patient's habits before even touching their back, allowing for the identification of contributing factors.
We're talking about a symptom for which there's 100 or more different pathways and mechanisms there.
However, a patient's testimony can be limited, especially during brief visits, so more comprehensive methods are necessary for accurate assessment. The Gonstead method includes 5 criteria to analyze spinal health. Visualization helps identify subtle changes in posture and movement. Instrumentation, particularly the nervoscope, detects uneven heat distribution along the spine, which may indicate inflammation and nerve pressure. Static palpation assesses the spine for swelling, tenderness, and abnormal muscle texture, while motion palpation evaluates how the spine moves in different directions. Lastly, X-ray analysis provides a detailed view of the spine structure. I mentioned the nervoscope, a staple tool for Gonstead practitioners. One of my main critiques of chiropractors is that they often rely on their hands for assessment, which may not gather the same level of data as medical tools might. However, a 2013 review by Dr Chiriano analyzing 201 studies on methods for assessing the site for applying manipulation found stronger evidence supports more direct measures over thermography and skin conductance. But that was a decade ago, and to be fair, chiropractors may not have had access to the best tools at that time. With advancements in technology, we could have much more effective tools now. So let's take an objective look at the nervoscope.
When nerves pinch off at the spinal level, they will often have effects outside of the spine. So wherever the nerve goes, you get trouble.
The nervoscope supposedly measures temperature differences along the spine, which are reported to indicate inflammation caused by nerve pressure due to conditions like stenosis, where the spinal canal narrows and compresses nearby nerves. This compression can lead to inflammation, which the nervoscope detects through heat variations.
The needle will go to one side, or it'll go to the other side. So you can see as the needle goes to one side or the other, what is it actually measuring?
Chiropractor Adam Story explains that in acute injuries, increased blood flow to the area due to tissue trauma and nerve hyperexcitability will show as a rise in temperature. Conversely, in chronic conditions, reduced blood supply can result from poor oxygenation of the tissue, leading to fibrosis and a decrease in temperature readings. Therefore, the nervoscope can potentially help identify both.
We want to make sure it's equidistant, so we're not running it straight this way. That's wrong.
While the nervoscope itself has little to no scientific research, it is based on similar principles to thermography, whose reliability is still debated as a diagnostic tool. As a heat measuring device, it's unclear how we can confirm that any detected heat originates from spinal tissues, as heat can also arise from infections, cancer, autoimmune disorders, metabolic conditions, inflammatory skin changes, or vascular problems, all of which require treatments beyond chiropractic care. All of these diagnostic methods should be used together to assess patients. So while I don't dismiss the nervoscope entirely, not quite entirely, I don't see it as the ultimate solution, and its diagnostic validity is certainly in question. That said, I do appreciate efforts to precisely locate the exact site of injury or irritation, as the Gonstead method emphasizes doing as little as possible to adjust it, which is a green flag, along with the advice, if it ain't broke, don't fix it, indicating they're not aiming to be out here RKOing your back.
Literally causing yourself to have a ligament injury. You're elongating the ligament with all these manipulations.
He notes that much of the pain people experience may stem from muscles compensating for what ligaments are supposed to support.
So you temporarily feel better, but you're actually making the problem worse.
So if we can fix a whole lot with minimal intervention, we know we've targeted the root. I noticed that Dr. Rahim approaches balancing the body like balancing an equation. By analyzing x-rays and seeing where, for example, this hip is higher, this shoulder is lower, he determines how much each side of the body needs to be adjusted to achieve symmetry.
If I adjust your pelvis, it makes it 4, but if we can get this up here, it makes it back to 2.
The spine isn't technically completely straight. In fact, it has several natural curves when viewed from the side. Sagittal balance refers to the proper alignment of these curves, ensuring minimal muscle effort while standing. The spine can also bend from side to side, though it's not meant to stay in those positions. Dr. Rahim often compares the spine to a 24-story building, emphasizing the importance of a strong foundation. Your lumbar spine, or the bottom third of your spine, supports the upper parts of your spine. It connects to your pelvis and bears most of your body's weight, as well as the stress of lifting and carrying items.
Lift with your lower back in a jerking, twisting motion.
These areas, along with the hips and the tailbone, are codependent, so a problem in one can potentially cause pain in the others. Another reason why a focus on the base may be important is, as Dr. Rahim explains, the leg length discrepancy between sides must be less than 7 millimeters for any adjustments to hold. Leg length discrepancy can lead to and can be influenced by compensatory changes in spinal curvature, as well as factors like congenital issues, injuries, and arthritis. Addressing these foundational issues provides the most significant benefit, as neglecting the connection between the spine and the legs may result in upper manipulations that aren't sustainable or perhaps not even necessary, like most of the time. To finish off every session, Dr. Rahim gives a little buff and polish, basically vibrational therapy using a Theragun. Chiropractors may apply vibration to prepare muscles for adjustments, facilitate recovery, and reduce pain in conditions like myofascial pain syndrome.
When we go over regular tissue, it does nothing. When it goes over scar tissue, you feel a little bit of that tickly spice.
Yeah.
Fascia is a thin nerve-filled connective tissue that surrounds and supports every organ, blood vessel, bone, nerve, and muscle in the body. It consists of multiple layers with a fluid called hyaluron in between, allowing for flexibility during movement. However, dehydration can cause fascia to thicken and become sticky, restricting movement and creating painful knots that can compress muscles. This is why sometimes fascia pain can be confused with muscular pain. I appreciate that Dr. Rahim assigns homework to his patient, which includes not just icing and resting, but also dietary advice and specific exercises, some of which he shares online.
So he can also do flossing for the shoulders, and it's 4 exercises that uses a gym ball.
He emphasizes the importance of walking, suggesting that it promotes proper spine alignment by encouraging the alternating movement of our arms and legs, which helps maintain balance and stability while engaging the muscles around the spine. Overall, Dr. Rahim seems like a competent chiropractor, but there's a hint of overconfidence in what even his adjustments can actually achieve.
Don't be fooled by the cracks that I got. I'm still Hemi from the block.
In chiropractic treatments, it can often be more about the perception of pain relief after enduring what feels like a stressful event. So, it's important to approach these claims with a healthy dose of skepticism. Dr. Rahim's charisma and depth of understanding create a reassuring atmosphere, making patients feel like they're in good hands.
Wow. Yeah, and this is not even an exaggeration. Every single time.
And this is not a paid advertisement.
He has a way of captivating patients, giving the impression that he instinctively knows exactly what's wrong and understands their bodies, even recalling past issues they might not even remember.
And I really do appreciate
You're
everything.
welcome.
I really, really, really do.
You're
like
welcome.
I really appreciate it.
You're welcome.
By using a patient's native language, he fosters a sense of comfort and connection. Before they know it, patients often find themselves thinking, wow, I feel better, bro.
So you're saying you just had a screw loose behind your neck that needed a little tightening, huh? That's all it was? Have a seat, senor. I like. Bueno. Muy bueno.
However, the question remains, how do patients feel after a few weeks? Is the relief lasting, or is it just a temporary fix?
I was shocked. I really didn't expect
one adjustment?
I didn't expect anything with that adjustment because for having like almost 10 chiropractors, I didn't see any changes before. But
So then what did
I
you
didn't expect. I was like, oh, I don't have that neck pain anymore.
The rapport between a healthcare provider and patient is crucial and should not be underestimated. Feeling good during appointments can significantly influence a patient's overall experience, perceived pain relief, and thus adherence to treatment. And maybe we need more of that in doctor offices too, but building a supportive relationship should also be grounded in realistic expectations and evidence-based results. If you enjoyed the video, be sure to leave us a comment and give it a big thumbs up to feed the algorithm. If this is your first time to the channel, welcome. Be sure to subscribe for more content that helps you understand human anatomy in an engaging way. We are well on our way to 700,000 subs, and we would love to have you with us when we get there. If you didn't like the video, be sure to let me know why in the comment section down below with all of the other chiropractic fanboys. I read as many comments as I can, and we use your feedback to make our videos better for you. Don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Or its sister channel, Human at Home, where you can learn how to be healthy right where you live. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.